Recently, a woman sat down in front of me, 63 years old, sharp, active, takes her grandchildren to their activities, cooks, cleans, runs the whole household herself. She looks at me and says, "Dr. Alicia, by the evening my legs look like an elephant's. I take off my socks and there are deep grooves in my skin, like a rope was tied around my ankle. My husband says it's age. My friend says it's the heart. I read online it could be kidneys. I don't know who to listen to anymore. Is this just normal after 60? And I said one sentence that made her go completely silent for about 10 seconds. I said, "There is no such thing as a normal swollen leg. Every swollen leg is a letter from your body. The only question is, who sent it?" Today we are going to read that letter together. I'm Dr. Alicia. I've been in clinical practice for over 20 years, and the question I hear at least 5 or 6 times every single week is, "Doctor, my legs are swelling. Should I be worried?" Stay with me until the end, because by the time this video is over, you will know exactly what your legs are telling you, what to do about it, and when it cannot wait. Let me start with the basics, not from a textbook, but in plain language. Because if you don't understand what's actually happening inside your body, nothing else I say will make sense. Think of your body like a city. That city has a water supply system, your blood vessels. Water flows through the pipes, reaches every building, every cell, everything works. But here's the thing. Those pipes are not perfectly sealed. They're designed to leak a little. Through the walls of the tiniest vessels, the capillaries, fluid seeps into the surrounding tissues. And that's completely normal. That's how your cells get their nutrition. But the city also has a drainage system, your lymphatic system. It collects that excess fluid from the tissues and returns it back into the bloodstream. When the water supply and drainage are in balance, everything is fine. No puddles, no flooding. Swelling happens when that balance breaks down. Either too much fluid is leaking out, or the drainage can't keep up, or both at the same time. Fluid collects in the tissues. The tissue puffs up. Your leg gets thicker. Your shoe doesn't fit. The sock leaves a deep groove. Now, why the legs specifically? Simple. Gravity. We walk upright. We sit upright. Fluid flows downward to the feet, the ankles, the calves. By evening, after a full day upright, that's where everything collects. And here is your first key fact to remember. If your swelling appears in the evening and is gone by morning, that is one story. If your legs are swollen when you wake up, that is a completely different story. The difference between those two situations is enormous. We'll come back to it, but hold that thought. One more thing before we go further. The groove from a sock is not automatically a sign of swelling. A tight elastic band leaves a mark on any leg, healthy or not. But if the groove is deep, wide, slow to disappear, and the skin around it looks shiny and tight, that's different. That's fluid in the tissue. Here's a simple test your doctor uses at every appointment, and you can do it right now. Press your thumb firmly on the inside of your lower leg, just above the ankle where the bone is close to the skin. Hold for 5 seconds. Release. If a dent remains and doesn't spring back immediately, that is swelling. You can press pause right now, check, and come back. I'll wait. If there's no dent, wonderful. But stay with me because everything I'm about to say matters for prevention. If there is a dent, absolutely stay, because we're about to figure out exactly what it means. Before we go any further, I need to address something that I hear constantly, and it genuinely bothers me every time. After 50, swollen legs are normal. It's just age. No, it is not normal, and it is not just age. Yes, with age, our blood vessels become less elastic. Yes, the lymphatic system slows slightly. Yes, we move less. All true. But healthy legs at 60, 70, even 80 do not swell regularly for no reason. If your legs swell consistently, that is a signal, a clear, specific signal that something in your body is working under strain. Think of it like the check engine light on your car dashboard. When it comes on, you don't put tape over it and say, well, the car is 15 years old, that's normal. You go to a mechanic. You find out what's wrong. Swollen legs are your check engine light. And today we're going to look under the hood. If I had to rank the most common causes of leg swelling that I see in my practice, veins would be number one, by a wide margin. Here's how it works. Your heart pumps blood down through the arteries all the way to your feet and toes. The blood delivers oxygen and nutrients. Then it needs to return back up to the heart through the veins. Think about that. Blood needs to travel from your foot all the way up to your chest against gravity over a meter of vertical distance. How is that even possible? 3 things make it work. First, your calf muscles. When you walk, your calf muscles squeeze the veins like wringing out a wet cloth. They push blood upward. Doctors actually call this the calf muscle pump. In a sense, your calf muscles are a second heart, a small one but a vital one. Second, your breathing. Every time you inhale, your diaphragm drops and creates a slight suction in the chest that pulls blood upward from the lower veins. Every breath literally helps your blood return to your heart. Third, and this is fascinating, valves. Inside your veins are tiny one-way doors, like turnstiles. They open upward to let blood through and snap shut when blood tries to flow back down. Open up, close down. That's the system. Now imagine those valves stop closing properly. Blood starts flowing back down. It pools in the lower sections. Pressure builds inside the veins. The walls stretch. Fluid gets pushed out into the surrounding tissue. That is chronic venous insufficiency. In simple terms, your veins can no longer properly push blood upward, and the lower legs start to flood. Here's what most people get wrong about this. They think varicose veins means those visible twisted blue cords on the surface of the leg. And yes, that's one form. But the more serious problems happen in the deep veins, the ones you can't see. Someone can have perfectly smooth-looking legs and still have severe deep vein insufficiency. You cannot diagnose your veins by looking at them from the outside. I had a patient, a security guard, 57 years old, former military man, spent 12-hour shifts sitting in a chair. By evening, his legs felt like weights had been attached to them. He ignored it for 3 years. 3 years. Because I'm a man, legs get tired, that's normal. He came to me when the skin on his right shin started turning dark brown and began to itch. We did an ultrasound. The valves in his deep veins had failed. The blood had been sitting there for years. That darkening skin, the beginning of tissue breakdown. 6 more months and he could have developed a venous ulcer, an open wound that heals extremely slowly and painfully. If he had come 3 years earlier, when it was just heaviness and mild swelling, it would have been so much simpler to treat. How to recognize venous swelling. Appears in the evening, improves overnight after lying down. Starts at the ankle and lower calf, not the thigh, not the whole foot. Comes with a heavy, leaden feeling in the legs. Gets better when you raise your legs above heart level. In long-standing cases, the skin on the shin darkens to brownish or bluish. Legs feel cold, even though you might expect them to feel warm. Who is most at risk? People who sit or stand for long hours, office workers, drivers, teachers, hairdressers, cashiers. People who are overweight. Women more often than men statistically, though men get it too, they just wait longer to come in. Your action step. Book an appointment for a duplex ultrasound scan of your leg veins. It's painless, takes about 20 to 30 minutes, requires 0 preparation, and shows exactly how your valves are functioning. This is the single most important first step. Also, walk every single day. When you walk, the calf muscle pump activates. When you sit still, it stops. If you have a desk job, set a timer. Every hour, stand up and walk for 5 minutes. This is not a minor lifestyle tip. This is treatment. And every evening, 15 to 20 minutes with your legs elevated above the level of your heart. On the armrest of the sofa, on a stack of pillows, against the wall. Let gravity work in your favor for a change. When is it urgent? If one leg suddenly swells significantly more than the other, especially if it's painful, red, and warm to the touch, do not wait. That can be a deep vein thrombosis, a blood clot. That is an emergency. Go to the emergency room today. Take a breath before I say the word heart. I'm not here to scare you. Knowledge is not fear. Knowledge is power. Remember our city analogy? The heart is the main pumping station. When it weakens, blood starts backing up, especially in the legs, the hardest place to pump from. Pressure builds in the veins. Fluid leaks into the tissues. Swelling develops. This is called heart failure, not a stopped heart, not a heart attack. The heart is beating, but it's weakened, like an old pump that still runs but can no longer maintain the pressure it used to. And here's what makes it dangerous. The heart compensates silently for a very long time. Symptoms creep in so slowly that people adapt without noticing. First, legs feel slightly heavy in the evening, then real swelling, then shortness of breath on stairs, then at rest, then waking up gasping at night. I had a patient, 64 years old, retired engineer. His wife brought him in. She said, "Dr. Alicia, he used to run up 2 flights of stairs. Now he stops at the landing and grips the railing." I asked how long. He said 6 months. His wife said, 2 years, and every time I mentioned it, he said it was the heat or tight shoes. His heart was functioning at 38% of normal capacity. We started treatment. 3 months later, 45%, swelling nearly gone. He climbs the stairs again. His wife sleeps at night. Caught in time. That changed everything. How to recognize cardiac swelling. Both legs swell equally, always symmetrical. Gradually climbs higher over weeks, ankles, then calves, then thighs. Shortness of breath climbing stairs or walking uphill. Needing an extra pillow at night to breathe. Waking up unable to catch your breath. Unexplained weight gain of 1.2 kilograms per week with no diet change. Let me give you the summary, quick and clear. Swelling is always a symptom, never a diagnosis. Always find the cause. The 3 main suspects are veins, heart, and kidneys. Each gives a different type of swelling, and now you know how to tell them apart. Don't forget the less obvious causes: thyroid, medications, and daily habits. The home steps: walking, legs elevated, less salt, foot exercises, help regardless of the cause. Get the minimum test done. It's simple, affordable, and gives you enormous information about your own body. Know the red flags. One leg suddenly swelling, red, hot, and painful. Emergency, possible blood clot. Both legs swelling rapidly with breathlessness at rest or waking up unable to breathe. Call an ambulance. Swelling combined with chest pain, severe weakness, or blue lips. Emergency room, now. And most importantly, stop telling yourself it's just age. Your body is talking to you. Learn to listen. Now, I have a request for you. Write in the comments, which step from today's video are you going to take first? Book the vein ultrasound? Start the 30-minute walk? Cut the processed food for 3 days? Write it down. I read every comment, and your answer might be exactly what someone else needs to see to finally make their own appointment. If this video helped you, please like it. That helps this reach other people who are sitting at home right now with swollen ankles, telling themselves it's nothing. Subscribe if you haven't already. Every week I talk about the things that fall through the cracks in a 15-minute appointment. I'm Dr. Alicia. Take care of yourself and take care of your legs. See you next week.